Hey y'all, it's your girl O'Shea. You're tuning into another episode of O'Shea Speaks. Thank you so much for coming to my channel. If you are new here, go ahead and make sure you subscribe, hit that notification button, and then go ahead and like the video as well. If you're returning, hey O Squad, it's good to see you guys. Okay, so we're just gonna get right into this video. As you can tell by the title, today we are gonna be talking about something that is very important, and that is 10 reasons why social workers are essential, period. The reason why I wanted to do this video is because I wanted to encourage my social workers who are at the front line of this pandemic and still working. Sometimes, unfortunately, we can go unnoticed. That's just the truth. And this is not to, lower down the importance of nurses and doctors and, people that are working hard at the forefront. But to the truth be told, I ain't seen a lot of stuff about social workers. That's just the facts. And what I do know as a social worker myself, or coming social worker working in human services, is that we're essential and we still have to work too. So I just wanted to make a little video to shout out y'all for what y'all have been doing during this pandemic, because y'all putting in work. So I came up with 10 reasons why social workers are essential. Let's get into it. So, number 10, social workers are working at the front too, okay? And what I mean by that is, alongside nurses and doctors, there are also medical social workers. Hospital social workers working in patient homes, nursing facilities. I had to write notes. We are getting direct contact with patients in the hospitals because that is part of our job. At the end of the day, even though they might be in the hospital, they still need someone that's gonna help address the psychosocial and psychological and social needs of them as a patient, of their family, things like that. So we are still working in the hospitals. Social workers are another occupation that's still working in the hospitals. Okay, so number 9, macro level social workers, okay? So social workers on the macro level, they are still running the community, running the different systems, and social workers, they might not have the total of social workers, but there's a lot of healthcare administrators, public health administrators who actually hold their MSW or some type of social work degree or some field of human services, and they're over organizations, nonprofits, community health organizations, things like that. And at the end of the day, even though everything's shut down, most of the time, people that are running, nonprofit organizations and human service organizations and stuff, they can't really, I'm not gonna say they can't afford to close everything down, but it's not as easy to just be like, I can't serve the community, So they still serving on a macro level. They keeping things running. Number 8. So this one was interesting, but I had to go back to things that I learned in while receiving my master's. And a big portion of the master's program was research. And I never really understood what was the purpose of research or how social workers do research. But in my classes, I learned that social workers are researchers too. Like, there are social workers who literally obligate their lives to just doing research. And this is essential because there's a lot of research that needs to be done on what's going on right now with the COVID-19 pandemic. And when I say there's a lot going on, is our Black and brown people are dying at a higher rate than other races. Which, were we really surprised? Can't say we were. It's unfortunate, but can't say we were. But anywho, there are social workers that are doing research to collect data and collect the facts on what's going on with this COVID-19, what communities, what individuals, what populations are being mostly affected by this, why they are the ones that are being mostly affected. And then once we're gathering the research, we're using it. So in the future, we can have some data to show us what direction to go. Where should we go? What should we do? So believe it or not, social workers do research too. It's essential. Number 7, the community and people in the community, they still need resources. And the resources, I mean, go from like food to shelter, to financial, all kind of things. And although we're highlighting what's going on and the people that are affected with the coronavirus, there's still people that needed to be served before this was going on. So their issues didn't stop. Their issues didn't stop just because a whole bunch more issues came. If anything, their issues got worse. As social workers, we usually find ourselves in serving positions. So these communities still need to be served in some kind of way. If it's providing housing, if it's providing food, or just the basic needs, people are still out there. And one of the main positions that you hear that help people in these situations are social workers. They're the main ones out there. Number 6. So this one kind of hits home to me because this is basically what my job is about. But families, children, kids, mom, dad, they are still in crisis or still experiencing crisis in their home. What I mean by that is there are children that are at home that may be experiencing some kind of violence, some kind of abuse, some kind of neglect, that if they were able to go to school, they would not have to go through right now. Most of the time, the occupation or the positions that address these crises that are going on in the home are mental health professionals or social workers, right? So you have social services, you have somebody like me who's an intensive in-home case manager. You have a crisis line where people respond to different crises. And again, even though these issues were going on before the coronavirus, they didn't stop. If anything, the coronavirus has made them worse. Therefore, social workers are still needed to address these issues. Essential. Number 4, this is kind of a combination of a few things, but I just have to say it, case management. Because there's so many different type of case managers. There's so many different realms of case management. And that kind of goes back to the community that still needs resources and, the crises that are going on that still needs resources. At the end of the day, case managers are important, from the hospital, from social services, from a mental health standpoint. We are literally helping our clients on a day-to-day basis with their everyday needs and their everyday challenges. And again, that does not stop just because of all of this is going on. So we're still having to work. We're still having to case manage. We're still having to call in and check and say, hey, Ms. Johnson, we just calling to see, did you take your medication today? Did she take it? Did she take it? Who gonna check? Who gonna check and make sure Ms. Johnson took her medicine? Her case manager, I can guarantee that. And what do I? Essential. Number 3, social workers are therapists too. And I just have to say that because I'm getting my MSW. A lot of people always ask like, oh, you're getting your MSW, you're gonna work for social services. And that's no shade to people who work in social services. We need people that work in social services. And from what I hear, social services pay pretty well. However, no, I'm not going into social services. And no, all social workers don't take people's kids out their home. Social workers are therapists too, which is, as you heard me say multiple times on my channel, is why I'm going to get my LCSW so I can do private practice, therapy, serve people's mental health. People still need that. Again, probably more than ever. Being locked up in this room, well, not this room, but locked up in your house, locked up in your apartment for now we're going on 2 months, and who knows how much longer it's gonna go. People literally still need their services. So they might not be able to go to a therapist's office, or they might not be able to, go to an organization's, facility or whatever. But we have different things in place like telehealth and Doxy and all these other ways that are still allowing people to see their therapist. Because They need therapists. I need a therapist. You need a therapist. If you don't got a therapist, you need to go get one. I'm telling you right now, because everybody needs somebody to talk to. And social workers can be therapists. Social workers are therapists. I mean, it's just that easy. And at the end of the day, therapists are what? Essential. Okay, number 2. So this kind of ties into the last thing, but mental health as a whole. Okay, let's just talk about it. Okay, depression, anxiety. Think about people that are extroverted and their lives are literally ran by their social engagement. Okay, I'm really also talking to myself, because literally, as y'all can tell, I like to run my mouth. I like to talk. I like to run my mouth. And I like to be around people. I like to have fun. I like to go to parties. I like to do things and see people. Think about those people. They literally can't see nobody. So the anxiety is probably over the roof. The depression is probably over the roof. People who have other mental health disorders are probably really, really struggling right now, because this is an adjustment. Literally, it's an adjustment. The whole world is adjusting to what's going on, from not being able to go to certain places, only being able to go to stores at a certain time, literally stay at home orders, like stay in your house, stay 6 feet away from people. This is affecting people on the mental health spectrum in all kind of ways. You got kids who are used to a structure of going to school, coming home, going to after school program, doing this, doing that. And literally without that structure, they cannot function. Again, social workers, even though there's a lot of positions and things like that, a basis of what we learn, a bulk of what we learn in our grad programs, in our undergrad programs, we learn about mental health disorders. We learn how to communicate with people. We learn how to, work with people who have different disorders. So we all have some kind of background, some kind of knowledge on the different mental health disorders, the different diagnoses, things like that. We all have knowledge on them. And at the end of the day, we as social workers, we are one of the professions that are there to address people who have these challenges, people who have these diagnoses. So without us, I mean, it's pretty self-explanatory. Essential. And my number one reason why social workers are, why did I say social workers? My number one reason why social workers are essential. I'm gonna have to read this because I wanna make sure I get it right, because I typed up something real nice. The world needs social workers. We are a profession that recognizes and understands the importance of human functionality. We help individuals, families, groups, communities, all of the above, with the things in society that are impacting them. There are so many capacities that we serve in, from medical to social services to mental health. The list goes on and on. I guarantee you, no matter what type of occupation or profession or organization that you work for, there is some social worker that is involved in some kind of way. Again, I just want to shout us out, because truthfully, honestly, on the Facebook pages that I'm in and the groups that I'm in with different social workers, although we don't do our jobs so we can get a pat on the shoulder, although we don't do our jobs for that, when we're going out and being essential, and this goes for all occupations, nurses, doctors, people working in the grocery store, things like that, people that are risking their lives. When we go out and risk our lives every day, right before we get to that breaking point where we feel like we can't do it anymore, or this is just too much, I know I have to serve this community, I know I have to serve these people, but what about me? Just when we are about to give up, having the support and having someone say, hey, what you're doing is so important. We love you for what you're doing. We appreciate what you're doing. That right there will allow somebody to keep going. And in the midst of how hard it is to keep going, having somebody there to say, I appreciate you for what you do, will literally keep that person going one step forward, one step at a time. So that's why I wanted to make this video, because I want the social workers out there that are essential, that ain't getting no shout outs, that ain't, really being acknowledged for the fact that they still have to go to work every day, risk their lives, risk their family lives. I want to let you know that we appreciate you. Thank you for what you are doing, and please, please, please keep going. Stay safe, but keep going. There's so many different people that are still risking their lives every single day to help us in this crazy thing we're calling life right now. And so I just want to pour into you and let you know that it is so appreciated. Thank you so much for what you're doing. Please stay safe, but please keep going for us. I'm gonna keep going as long as I can. I'm gonna keep going. So I need y'all to keep going too. You guys stay positive, stay safe, social distance yourselves, stay in the house if you can. And yeah, that's my little spiel. That's my little video. Thank you again so much for watching. I hope you enjoyed today's video. Please, if you haven't already, go ahead, hit the subscribe button, hit that like button if you like what I was talking about today, and go ahead and share the video too. Why not? Also, comment below and let me know if there's any additional things that you can add, because I know I didn't cover it all. I know I probably was very broad, and I probably could have been a little bit more particular, but I know I didn't cover it all. So go ahead and comment below and let me know if there's anything that you would add on reasons why social workers are essential. See y'all later. Bye.